Hello everyone. In this INR number 52, we are going to discuss about another important PYQ called as Pterion. So what is Pterion? When you have a lateral view of this skull, they are junction between the four bones. Remember, junction between the four bones. Who are these bones? Greater wing of sphenoid bone. Number one is sphenoid bone. Then squamous portion of the temporal bone. So number two is temporal bone. So what are the two bones? Sphenoid and temporal bone. Third and fourth is frontal bone and parietal bone. So what are the pterion? Pterion is a junction, right? Junction formed by four bones. What are the four bones? Sphenoid, temporal, parietal and frontal. These are four bones. And when you are seeing from the lateral side, these are four bones. When you will see from the inside of the skull, you will see the lesser wing of sphenoid will be lying deeper into the pterion. Or you can say that when you go inside, you will see that lesser wing of sphenoid will be also present like this. So you can see this is the internal part of the skull, right? So what we can say that lesser wing of sphenoid will be lying deeper to the pterion, right? What is the clinical significance of this pterion? So as you can see in this pterion, there is a artery passing which is called as middle meningeal artery, right? So pterion overlies the middle meningeal artery. Second important thing, pterion is the weakest and thinnest part of the skull. Remember, these are thinnest and weakest part of the skull. So what will happen? Because of trauma, this will be fractured easily, right? So as a result, what we will see, there is a rupture of middle meningeal artery and this will cause epidural hematoma or epidural hemorrhage. So because of middle meningeal artery rupture, they will have epidural hemorrhages. So these are the importance of the pterion. So thinner and weaker part, prone to the trauma and fracture, and this will lead to the middle meningeal artery rupture, and because of this rupture epidural hematoma will be seen in this patient. So keep revising this topic for your upcoming exam. Best wishes for your exams.